Autism is the word used to describe a lifelong difference in a person's neurology. It is very difficult to say exactly what it is because it can't be separated from the person. During their lifetime, an autistic person will see, process and understand the world in a different way from somebody who isn't autistic. While autism doesn't present the same for every person, these are the 3 most common traits of autism which may affect the way a person interacts with others in social situations, is able to communicate with others, and experiences the world around them. If you believe you or those you are responsible for have autism, you should talk to your GP or health visitor about your concerns. You can also ask to be referred to another relevant healthcare professional. This could be a psychologist or psychiatrist, or if for a young child, a paediatrician or child development centre, sometimes known as CDC. For a child, you could also speak to their teacher or to the school's special educational coordinator, also known as SENCO, for advice on how to get the right support. We don't know exactly why more men and boys are diagnosed as autistic than women and girls. It is clear that many autistic women and girls are missed or misdiagnosed. It was previously thought that there were many more autistic men than women, but estimates of ratio have gotten closer and closer over the years. Current study shows that 3 males to 1 female are diagnosed with autism. There are many theories that include women and girls are more likely to mask or camouflage their differences. Autism assessments are less sensitive to autistic traits that are more commonly found in women and girls. A range of biological and environmental factors may mean men and boys have a higher chance of being autistic. Traits of autism can vary from person to person. Adults who've been living with autism for some time may be better at masking their signs and symptoms. Traits can also differ across genders. Some people are also able to cope better with social situations than others, as their symptoms may be more subtle. Certain traits or symptoms can also become more pronounced and problematic as an individual grows and becomes subject to different environments or situations. Autism is often diagnosed alongside other conditions, ADHD being one of them. People with autism also have a higher risk of having epilepsy, with 20 to 40% of those with autism developing this. Autistic people can often have trouble sleeping. There are a range of reasons for this, including difficulties with relaxation or winding down and irregular levels of melatonin, a sleep hormone. There is also increased stress and anxiety or sensory differences, including sensitivity to blue light, sounds and white noise. Some autistic people are completely non-verbal, and some are what is sometimes described as selectively mute, meaning they can speak in some situations and not in others. This is caused by anxiety and not a deliberate choice. Many autistic people can speak with ease and have no difficulty using language. However, even some with high-level language skills may struggle to speak or understand in certain high-stress situations, perhaps due to being overwhelmed in social, sensory, or unpredictable situations. You should never assume that an autistic person who uses high-level language will always understand everything you say, or will always be able to express themselves well, either verbally or in writing, and you should also never assume that somebody who is non-verbal or may struggle with speaking clearly and consistently does not understand you.